Although Becky stole most of my words, I noted everything, and she stole it all. I just want to speak with you a little about personal experiences in this. Most of we independent providers, of course, work out in the community, and a lot of times we work in a setting of apartment complexes and those types of things, low-income housing and such. I happen to work in a retirement community. If it were not for independent providers, home care providers, most of the retirement community that I work in would be in a facility. Probably 3/4 of the folks in that community receive home-based services. Many of them are, there are those with dementia, there are those with kidney failure, there are those that just need somebody to help them bathe, or their children. A lot of people don't realize that either, that a lot of these services are given to children. These children's parents work. Without these services, there's going to be a loss of a job because the parent's going to stay home. Because most of us know if we can care for our child, we're not going to send it to a facility to be cared for. And all of these things are a part of this. I say penny wise and dollar foolish. And you spend all this money on a long-term care facility, and in comparison, actually, there is no comparison, the money that you spend on home-based programs compared to the long-term facility care. Not to mention the fact that the consumers are so much better off. They heal quicker in their own homes. They're more familiar. Someone with dementia, you will keep them better in their own home because they're familiar. As soon as you bring them out of that setting and put them into a facility, you end up with more confusion and those types of things. In losing these IPs, these folks are facility bound. There's nowhere else to go. We provide transportation services. You know, we do the shopping. It's more than just going in and cleaning someone's home. A lot of folks look at home care providers as that's what they are, they're housekeepers. Well, there's much more than that to it. We provide an emotional setting for those folks. They have no one else to talk to. A lot of times you're there for that. You're there for their physical needs, their emotional needs. You're there to shop for them or to clean a bathroom because they're no longer capable of doing so themselves. I think that a lot of these girls also go an extra mile in helping to care for these folks. They spend out-of-pocket money to help care for these folks. It's not their responsibility to do that. However, there's a need for it. And so out of their hearts and out of their pockets, well, a lot of these girls no longer be able to do that. Myself, the transportation dollars that I spend are going to be greatly cut. When we go backwards on this pay cut, there will be trips made, but there won't be as many. A lot of times they want to just go for a ride. And as an independent provider, I can do that. I can take someone out to look at the trees. They change in the seasons. Those things will be less because I can't afford to do that any longer. So that knocks my care down. May not be a great thing to some folks, but if you're homebound, that is a big thing. Gosh, Becky said almost everything I wanted to say and said it so much more eloquently. But I thank you for allowing me to testify, and I just think it's very important that the state not be penny wise and dollar foolish. And at this point, with the money that goes to the nursing facilities as opposed to the money that goes into your home-based community organizations, that's the case. We have been, and we are still continuing to be penny wise and dollar foolish, and I think that that's what we need to look for, and ODJFS needs to push to having that balance so that everybody can continue to live with some dignity and in the place that they want to live. Thank you.
Okay, thank you for your testimony.